This isn't about one vendor or one environment. We're able to show how real-life patients who would get their care in multiple settings can see their data go from place to place.
This HIMSS showcase is a great way of showing prototypes of what can be, some solutions which are already in existence.
This is one of the first stops for a lot of companies to showcase a lot of their great interoperability that they've been building over the past year or several years. So I think it's a great environment to roll that functionality out, test that functionality, and then also show the rest of the world what we can accomplish.
The HIMSS Interoperability Showcase provides an opportunity for clinicians to really see what is real about interoperability.
It's really been the best QA lab we could ever ask for. It's been a really good experience in terms of what we could expect to see in the field. And all in all, we've learned a lot and our products have really grown from it.
Because it allows us to see each of our vendors working side by side to make their information available to other vendors.
It helps us actually structure the development because we know what we need to develop in terms of interoperability.
For our company, it's important just to have a presence here at the showcase.
Rather than just talking about solutions on a show floor, at a kiosk, and in academic terms, we're actually demonstrating how systems can interoperate with each other. I think a forum like this at HIMSS is just critical, and I think that's represented by the robust attendance.
We can really resolve the problems in starting collaboration.
Having a forum like this is important to Siemens. It gives us a great opportunity to interact with the other vendors.
Competing vendor systems and showing real patient information.
It gives us a neutral playing field. It gives us a place and an opportunity to come together and test technologies.
It really enables visitors to the annual conference to be aware of what's out there and what can be accomplished today.
This is an area where we can really highlight how our systems do improve the quality of care and reduce costs.
My experience as CEO of ForCare BV has been that IHE really allows us to address actually the global market.
A lot of what we're doing here is actually stuff that is going on in the real world.
In about 2 days, we interconnected about 80 or so systems in a quite a rapid manner.
What we're doing here with IHE really is much closer to plug-and-play functionality. So when we got here early to set up our systems, and it was very little effort to get those systems working.
The testing that we did at the Connect-a-thon really helped us here because we knew things were going to work.
There's no other place where you get this same kind of group of people with knowledge of all of the different standards.
They can come to one location and see all of these different clinical information systems exchange patient data across communities of care, just like it would be in a real environment.
We've collaborated, we've commiserated, and we've cooperated.
We want to make sure that we are doing things that are important to our world today and not something that perhaps was yesterday's work.
Because it's only through involvement of other vendors and the growing support of the community that processes like this can have an effect.
If you're not participating now, then you're not going to be a player later.